80% of Americans will experience a back problem during their lifetime, but medication isn't always the answer. Here to tell us about some simple solutions that can help ease the pain, including exercise, are Dr. Brook and physical therapist Pedro Romero with the Adventist Health Spine and Pain Center in Hanford. Thank you both for making the drive, really. I appreciate it. All right, back pain and spine pain. Doctor, how common is this among people, and is it an age thing?
It's definitely an age thing, but it happens across the spectrum to pretty much anybody. 20 to 80, it's very common. About 1/4 of people will experience back pain for at least one day in the last 3 months. The whole age group of people.
Wow, lower back pain,
We're
or is there a
lower
certain
back.
Lower back. And what are some of the most common reasons people get back pain?
Probably the most common is due to muscle injury, so overexertion, lifting things, just exertional problems with the ligaments as well as the disc are the most common three reasons.
Does this gradually come on, or is it something that where you're pretty healthy and you're in pretty good shape, and then all of a sudden, boom, you bend over and all of a sudden you feel your back crack and there it goes?
Certainly it can happen acutely like that, and that's probably one of the most common ways that patients start to notice having back pain. But for some, it's just overexertion over time, but it can be both of those ways. I think the acute way is what gets people's attention.
Definitely so.
They come see doctors.
Pedro, physical therapy, something new there at the Spine and Pain Center. How can therapy help?
I would say two main ways that it can help.
Okay.
First one is exercise.
Okay.
You know, they followed 20,000 people over 11 years, and they found that when people exercise, they were less likely to have pain.
Okay.
And when people exercise 3 times a week, then they get 26% less probability of having pain.
No kidding.
So the second way is manual therapy, which research has shown that it helps to have a hands-on approach to pain. So physical therapists will manipulate, mobilize soft tissues and joints to try and help with the pain, and more importantly, to get people moving again, because movement is extremely important.
Oh, definitely. Okay, so there are several ways to alleviate the pain, and those are just 2 of them.
2 of them.
All right, so let's talk a little bit more about ways to alleviate the pain without medication, because is it true that a lot of us think, okay, well, my back hurts, so I'm just going to take a quick ibuprofen or some sort of medication? Is that necessarily the answer most times, doctor?
Well, that's a good question. I think that many of us are looking for a quick and easy way to fix our back pain, and anti-inflammatory agents actually will help for acute and subacute pain as well as chronic, but probably best for long-term benefit is different exercise forms. We know that for acute back injury, massage is certainly helpful. Limiting your bed rest, I recommend it at most 2 days of rest if you have an acute injury. Trying to maintain healthy body weight, decent habits, quitting your smoking, things like that will help you hopefully prevent, and it helps tissue heal.
Even sleeping a certain way. Is that right, Pedro?
Right.
Yeah.
Yes.
How should we be sleeping then?
There's several ways depending on whether you're a back sleeper, whether you're a side sleeper. There are different ways that different positions that are comfortable, more comfortable for people. But I would say if you're sleeping on your side, it's not a bad idea to put a pillow between your legs to help keep your spine a little bit better aligned.
No, I thought only pregnant women did that. I guess it's good for all of us.
Yeah, if you are a back sleeper and you're having problems laying completely flat, then maybe putting something underneath your knees to kind of help alleviate some of the back pain. So, yes.
You know what I saw on that graphic that seems pretty interesting, and you mentioned it, quit smoking. Now, what does smoking have to do with lower back pain?
Well, it's interesting. There's lots of studies that there's an association with prolonged and more chronic low back pain in smokers. We know that smoking will delay healing of tissue. So we certainly know in surgical patients that smoking puts them at higher risk for delayed healing. We see the same thing with low back pain, especially in injured workers. There's a good association with poorer outcomes in our injured workers who smoke than non-smokers. So I'm not entirely sure why, but there's some connection.
Just another reason to quit. right, doctor?
Another good reason to quit
another
smoking.
good reason to quit. Also, I saw ice. Does that really work? Ice on pain like that, Pedro?
I would say you know, the research can be a little bit vary.
Yeah.
But certainly ice can definitely help to alleviate back pain, more so when it's an acute type of pain.
Gotcha.
It really help.
Okay, ice and heat, which is interesting. So there's also yoga, because we saw yoga exercise, obviously very important. So you've got some tips for us, right, Pedro?
Yes. I'm gonna go over some things, simple things that we can do at home to try and help back pain.
Okay, good. And he's going to demonstrate, because I'm not, right? All right, coming up after the break, Dr. Brooks and Pedro will show us some simple exercises that you can do at home. So stick around for that.